Hello, I'm Dr. Millie Long from the University of North Carolina, where I work in our IBD center. And I'm talking to you today about the thiopurine class of medications. And so this is an important class of medications that we use frequently in patients with inflammatory bowel disease. In this class, we have two essential forms, azathioprine and 6-mercaptopurine or 6-MP. There are also brand names of these drugs, such as Imuran or Purinethol. And so these medications are medications that help to slightly suppress the immune system. This is very important because inflammatory bowel diseases such as Crohn's disease and ulcerative colitis are actually caused by an overactive immune system that then results in inflammation. These medications over the past several decades have been used alone, for the treatment of Crohn's disease or ulcerative colitis. But more frequently now, they're used in combination with another medication, such as a biologic medication, anti-tumor necrosis factor alpha medication. And they've been shown to improve the efficacy of those drugs and also to improve the durability, meaning the drugs last longer because you don't actually develop antibodies to those biologics when you're on a medication like azathioprine or 6-MP. Azathioprine was also used in the past for prevention of rejection in patients with organ transplants. And actually the 6-MP form is actually a breakdown product of the azathioprine. And so they're dosed slightly differently. If you're on one of these medications, it typically means, for example, that you have not responded to other basic medications or that you've required a medication such as prednisone to try to get inflammation under control. These thiopurine medications are actually used more for maintenance. So once you've used prednisone or another medicine to help get the inflammation under control, as that prednisone is withdrawn, these medications help to maintain and prevent that inflammation from recurring. So what do you need to know about this class of medications, the thiopurines? Well, sometimes these medications can lower your white blood cell count. And so because of that, you're monitored very carefully, especially during the first 3 months or so after starting the medication. We regularly check blood, such as CBC, to make sure your white blood cell count is doing well at the dose you're on. Additionally, we often check an enzyme, something called TPMT, even before you start the medication, because that enzyme tells us how you'll break down the azathioprine with 6-MP and helps to tell us whether you should start at a regular starting dose or even a lower starting dose based on your ability to break down that medication. We also check your liver function tests regularly when you're on this medication, and typically at first, again, more frequently in those first 3 months, and then just once every 3 months, and that's because these medications are actually broken down in the liver. So what are the side effects? The most common side effect is actually that lowering of the white blood cell count, but again, it's not clinically significant typically, and we're monitored very carefully. We also can see a very serious side effect that is very rare, that occurs in less than 5% of patients, where immediately after starting the drug, someone can develop upper abdominal pain that radiates to their back, and this can be a sign of pancreatitis. And if this has occurred, you need to stop the drug immediately. It tends to improve quickly off the drug. And it's something that if that happens, you should not be restarted on the thiopurine. Sometimes patients can have some nausea or loss of appetite. This tends to improve. There can be a kind of period where you're getting used to the medication. I often have my patients take it at night, and they tend to not have some of those side effects. A couple of other things to know, very important to talk to your doctor about other medications that you take when you're starting a thiopurine. In particular, if you take a medicine called allopurinol for gout, it can interact with the thiopurine, and thus you need to start on a much lower dose. Otherwise, the medication itself, things to watch for, it is an immunosuppressant. It slightly suppresses your immune system. So you shouldn't take live vaccines when you're on this medication. Any inactivated vaccine is absolutely fine. Things like the pneumonia vaccine, the flu vaccine, the COVID vaccine, absolutely fine on this medication. It also likely makes you somewhat more sensitive to sunlight. And because of this, you should wear sunscreen, which helps to prevent the risk of skin cancer down the road. Also, this medication has been associated with a very rare increased risk of lymphoma, and I'm going to give you some numbers surrounding that. And remember that we do think that risk of lymphoma can be increased even in individuals who have other autoimmune mediated diseases like inflammatory bowel disease. But for most people sitting here or listening to this, the risk of developing lymphoma in the general population is about 2 out of 10,000 patients over the course of a year. When you're on this medication, that risk does go up. It goes up to 4, but 4 out of 10,000, which is still absolutely a very low number. And importantly, we have longstanding kind of studies following patients on these medications that once you stop the medication, that risk goes back down to baseline. So you're not accruing continued risk of developing this lymphoma. And so this medication most often is used in the first few years of starting a biologic to maximize that therapies, prevent antibodies. And in that scenario, again, we don't typically even see any of this increased risk until at least a year of therapy. And so we obviously try to maximize the safety and the efficacy when you're using this drug. Additionally, with these thiopurine therapies, they really just increasingly are shown to improve the durability of these anti-TNF medications. And so talk to your doctor about the risks, but also the benefits. For example, this thiopurine class of medication has also been associated with a reduced risk of colon cancer, specifically in patients who have longstanding colon inflammation. This medication reduces that inflammation and thereby reduces that risk. So we always have to weigh the risks and the benefits of each individual therapy. But I hope over this brief video, you've learned, how this medication works, what the potential side effects are to look for, why it's important because of the increased efficacy of use with these biologics, and that you talk to your doctor about not only starting the medication, but how long you're going to be on it and how it could potentially benefit you. So thank you very much.